Endometriosis is a chronic gynecological disorder affecting millions of women worldwide. It involves endometrial-like tissue growing outside the uterus, on organs like the ovaries and intestines. This tissue responds to hormonal changes, leading to inflammation, pain, and scar tissue. Endometriosis affects about 10% of women of reproductive age, though it may be underdiagnosed. Symptoms range from mild discomfort to severe pain and infertility, making diagnosis and management challenging. The condition's unpredictable nature often requires a multidisciplinary approach. Endometriosis profoundly impacts various facets of a woman's life. Chronic pain can disrupt daily activities, work, and relationships. The financial burden of diagnosis, treatment, and lost productivity is substantial. Emotional tolls include anxiety, depression, and strained relationships. Endometriosis can also affect fertility, sometimes requiring assisted reproductive technologies. Despite its prevalence, endometriosis remains complex and enigmatic. Its exact causes are unknown, but genetics, hormonal imbalances, and environmental factors are believed to contribute. Diagnosis often involves clinical evaluation, imaging, and laparoscopy. Treatment aims to manage symptoms, slow disease progression, and preserve fertility. Raising awareness and supporting research are crucial for empowering women with this condition. The most accepted theory for endometriosis development is retrograde menstruation. Menstrual blood flows backward into the pelvic cavity, where endometrial cells implant on organs. These cells thicken, break down, and bleed, causing inflammation and pain. Trapped blood leads to scar tissue and adhesions, binding organs together. This can distort anatomy and lead to chronic pain and complications. Retrograde menstruation alone doesn't explain endometriosis. Genetics may play a role. Women with a family history of endometriosis are at higher risk. Researchers are investigating specific genes and mutations linked to the disease. Identifying genetic factors could lead to targeted therapies. Genetic testing may help identify high-risk women for early intervention. Research also focuses on the immune system's role in endometriosis. In women with endometriosis, the immune system may fail to eliminate misplaced endometrial cells. Abnormal immune cell function and inflammation exacerbate the disease. Other theories suggest endometrial cells spread through the lymphatic system or blood vessels. Environmental factors like endocrine-disrupting chemicals may also contribute. Pain is the most prevalent and debilitating symptom of endometriosis. It often manifests as chronic pelvic pain, intensifying during menstruation. Pain can radiate to the lower back, abdomen, and legs. The severity of pain doesn't always correlate with the extent of the disease. Factors like implant location, inflammation, and individual pain perception contribute to the pain experience. Endometriosis often disrupts normal menstrual cycles, leading to irregularities. Dysmenorrhea or painful periods with heavy bleeding is common. Endometrial implants can interfere with ovulation, causing irregular periods. Chronic inflammation can lead to endometriomas or chocolate cysts, affecting menstrual cycles. Endometriosis is a leading cause of infertility, affecting 30 to 50% of women with the condition. Scar tissue and adhesions can obstruct fallopian tubes and interfere with ovulation. Pain during intercourse, bowel and bladder problems, and fatigue are common symptoms. Gastrointestinal issues like bloating and constipation are also frequently reported. Diagnosing endometriosis starts with a thorough medical history and pelvic examination. Your doctor will ask about symptoms, pain, menstrual irregularities, and fertility issues. During the pelvic exam, the doctor will feel for abnormalities in the pelvic organs. While the exam can identify potential concerns, it can't definitively diagnose endometriosis. Endometrial implants are often microscopic and hard to detect through touch alone. Further investigation is usually necessary to confirm or rule out endometriosis. Imaging techniques are crucial in diagnosing endometriosis. Transvaginal ultrasound uses sound waves to create images of pelvic organs. It can identify endometriomas but may miss smaller implants. MRI provides detailed images, especially for deep infiltrating endometriosis. Both techniques aid in diagnosis and treatment decisions. Imaging findings alone aren't always conclusive, as symptoms may not correlate with imaging results. Laparoscopy is the gold standard for diagnosing endometriosis. This minimally invasive surgery involves inserting a laparoscope through a small incision. The surgeon can directly visualize and biopsy endometrial implants. Laparoscopy assesses the extent of the disease and guides treatment. While accurate, it is a surgical procedure with inherent risks. Your doctor will discuss the appropriateness of laparoscopy based on your symptoms and medical history. Pain management is crucial for endometriosis treatment. Over-the-counter pain relievers like NSAIDs can reduce inflammation and pain. Other strategies include applying heat, gentle exercise, and relaxation techniques. These methods help relax muscles, improve blood flow, and reduce pain perception. The approach to pain management is individualized based on symptoms and patient preferences. Hormone therapy regulates the menstrual cycle and suppresses endometrial growth. The goal is to reduce estrogen production or block its effects. Birth control pills are often the first-line hormonal treatment. Other hormonal medications include progestins, GnRH agonists, and aromatase inhibitors. These treatments aim to reduce the growth and shedding of endometrial implants. Hormone therapy is tailored to the patient's needs and symptoms. Surgical intervention may be necessary when conservative treatments fail. The goal is to remove or destroy endometrial implants and improve fertility. Laparoscopy is the most common surgical approach. Techniques include excision, ablation, and cauterization. In severe cases, laparotomy may be required for extensive removal and repair. Surgery aims to reduce pain and restore normal pelvic anatomy. Section 1. Chronic pain and quality of life. Endometriosis, while often associated with menstrual cycles, can cast a long shadow, leading to chronic pain that extends far beyond menstruation. This persistent pain, a hallmark of the condition, can significantly impact a woman's daily life, affecting her physical comfort, emotional well-being, and overall quality of life. The pain associated with endometriosis can manifest in various forms, from a dull, constant ache to sharp, stabbing sensations. It can be localized to the pelvis or radiate to the lower back, abdomen, and legs, creating a web of discomfort that disrupts daily activities. Simple tasks like walking, sitting for extended periods, or engaging in physical activity can become challenging, leading to limitations in work, social life, and personal pursuits. The unpredictable nature of endometriosis pain adds another layer of complexity. Flare-ups can occur unexpectedly, disrupting routines and making it difficult to plan ahead. This uncertainty can lead to anxiety and fear, as women may constantly anticipate the onset of pain, further impacting their emotional well-being. The chronic nature of the pain can also take a toll on sleep, contributing to fatigue, irritability, and difficulty concentrating. Endometriosis stands as a leading cause of infertility, affecting a significant proportion of women diagnosed with the condition. The presence of endometrial implants and the inflammatory environment they create within the pelvic cavity can disrupt the delicate processes of ovulation, fertilization, and implantation, making it challenging for women to conceive naturally. The emotional toll of infertility can be profound, often leading to feelings of sadness, grief, loss, and inadequacy. The desire to conceive and start a family is deeply ingrained for many women, and the inability to do so can be a source of immense emotional distress. The diagnosis of endometriosis-related infertility can trigger feelings of isolation, as women may feel different from their peers who are able to conceive easily. The physical and emotional demands of fertility treatments, which may include hormone injections, invasive procedures, and the uncertainty of success, can further exacerbate stress and anxiety. The financial burden of fertility treatments adds another layer of complexity, potentially causing strain on relationships and overall well-being. Endometriosis, being a chronic condition, often necessitates a long-term perspective on management and understanding its potential for recurrence. While there is currently no cure for endometriosis, the good news is that with appropriate management, most women can experience significant improvement in their symptoms and quality of life. Treatment strategies, as discussed earlier, aim to alleviate pain, regulate menstrual cycles, and address any associated complications. However, it's essential to acknowledge that endometriosis can recur even after successful treatment, whether it be medication, surgery, or a combination of both. The rate of recurrence varies depending on several factors, including the initial severity of the disease, the type of treatment received, and individual factors that may influence the growth of endometrial tissue. Studies suggest that approximately 20 to 40% of women who undergo surgery for endometriosis may experience a recurrence of symptoms within 5 years. This highlights the importance of ongoing monitoring and management even after treatment. Regular checkups with your healthcare provider, open communication about any new or worsening symptoms, and adherence to prescribed medications or lifestyle modifications are crucial for minimizing the risk of recurrence and maintaining long-term well-being. Living with endometriosis requires a holistic approach, addressing physical, emotional, and social aspects. Empower yourself with knowledge, build a support system, and make lifestyle adjustments. Pain management strategies are essential. Explore complementary approaches like acupuncture, massage, or yoga. These can reduce pain and promote relaxation. Nutrition is crucial. Adopt an anti-inflammatory diet. Regular exercise releases endorphins and strengthens muscles. Manage stress with techniques like meditation and mindfulness. Connect with support groups for encouragement. Take an active role in your healthcare for a meaningful life. Endometriosis, as we've explored, is a complex and multifaceted condition affecting millions of women worldwide. From the debilitating pain that disrupts daily lives to the emotional toll of infertility and the challenges of navigating a chronic illness, the impact of endometriosis is far-reaching. Yet, by fostering awareness and understanding, we can empower women to take control of their health and seek timely medical intervention. Early diagnosis is crucial in mitigating the long-term consequences of endometriosis. The sooner the condition is identified, the sooner appropriate treatment can be initiated, potentially slowing its progression, alleviating symptoms, and preserving fertility. By recognizing the common signs and symptoms, seeking medical advice when concerns arise, and advocating for comprehensive diagnostic testing, women can play an active role in their healthcare journey. Knowledge is power, and this rings especially true for women with endometriosis. Understanding the intricacies of this condition, from its potential causes and risk factors to the range of available treatment options and self-management strategies, equips women to make informed decisions about their care and advocate for their needs. While endometriosis presents significant challenges, it's essential to remember that there is hope and a brighter future is possible. With advancements in medical research, diagnostic techniques, and treatment modalities, women with endometriosis have more options than ever before to manage their symptoms, improve their quality of life, and achieve their family planning goals. Ongoing research continues to shed light on the complex mechanisms underlying endometriosis, paving the way for the development of more targeted and effective therapies. From innovative surgical techniques and novel hormonal medications to non-invasive pain management strategies and complementary therapies, the landscape of endometriosis care is constantly evolving, offering new possibilities for improved outcomes. Beyond medical advancements, fostering a supportive and understanding environment is paramount. By increasing awareness within families, communities, and healthcare systems, we can help break down the stigma surrounding menstrual health, encourage open communication, and ensure that women with endometriosis receive the compassionate care and support they deserve. Together, let's continue to raise our voices, advocate for change, and empower all women with endometriosis to live full and vibrant lives. Thank you for watching. Please subscribe for more informative content.